Good afternoon. I hope everyone is doing well. My name is Hannah Decretia, and I'm a practicing OB/GYN medical doctor. Today, I will be presenting on the sexually transmitted infection known as chlamydia and its importance of getting checked and practicing safe sex and some preventative measures that everyone can take in order to stop the spread of sexually transmitted infections. However, in order for you to really understand the importance of the topic and the commonality of it, I really want to begin with a patient I had about 2 weeks ago. So my patient came in, she was a 19-year-old woman who presented to the office with some pelvic pain. She reported that it had progressively gotten worse over the week. She reported some dysuria, which is burning with urination, and a yellowish discharge. She also reported that she is sexually active and has had 4 partners. She uses an oral contraceptive or oral birth control, and she only uses condoms occasionally. I'm not sure how many of her partners she used a condom with. She didn't disclose that with me. So upon examination, my patient wasn't in any distress. Her abdomen was soft with some lower abdominal tenderness. She had some minimal yellow discharge and some severe tenderness in the cervix. So I decided to perform an STI swab, which is seen on the picture, and I sent it to the lab. We also did a gram stain of the discharge, but unfortunately that only shows polymorphonuclear leukocytes, which is really ambiguous. That could be many different things. So once the swab came back, it was positive for chlamydia trachomatis. So I know what some of you are thinking. Ew, she's dirty because she has an STI. But I really want to get rid of this stigma. STIs does not mean an individual is dirty, nasty. It just means they weren't educated, they weren't aware of it. So another thing I want to bring up is that the judgment that men and women feel with being diagnosed for an STI, sometimes when they go unreported, because they get that judgment that you're nasty, and let's fix that. We don't want that. So chlamydia is technically known as chlamydia trachomatis, and it is a gram-negative anaerobic bacterium that replicates in eukaryotic cells of a host. There have been 19 different serotypes that have been identified, and they all infect different areas. So serotypes A through C cause trachoma of the eye. D through K infects the urogenital tissue, and serotype L1 through L3 will infect the lymph nodes. And yes, you heard me right, a chlamydial infection can occur in the eye. I'll get into that a little bit later, so keep your ears up. Chlamydia has an ingenious infection cycle that occurs in 2 different developmental forms. The first form is known as the elementary body, which is when the bacterium is extracellular, metabolically inactive, and taken up by the host cells. The elementary body will bind to columnar, cuboidal, or transitional epithelial cells in areas that are lined by mucous membranes, such as the urogenital tract, and they will get endocytosed as they attach to the receptors of these cells. I have this process here. So once they get endocytosed, the elementary body will eventually differentiate into the next developmental form, which is known as a reticulate body. This body is the metabolically active form, and it'll grow and multiply. The chlamydia is, again, really ingenious because the reticulate bodies will transform back into the infectious elementary body and get released from the epithelial cells by exocytosis. This will allow the bacteria to infect even more neighboring cells and keep infecting as they keep switching from their developmental forms. And this life cycle takes anywhere from 48 to 72 hours, really just depending on the infection. So chlamydia trachomatis is able to infect many epithelial cells by transforming back and forth, like I said. It gets a head start as an infection. The immune system isn't too far behind. The innate immune system will begin fighting once epithelial cells are infected. The epithelial cells aren't immune cells, but they are able to initiate the immune response. So the first response is the production of pro-inflammatory cytokines, such as interleukin-1, interleukin-6, and tumor necrosis factor alpha, so referred to as TNF-alpha. These cytokines will activate other cells, cause them to differentiate, and recruit other immune cells to the site of infection. Essentially, these cytokines are throwing up a red flag to the rest of the body saying, hey, we need help over here. So the next cells that will come are known as white blood cells, but more specifically the neutrophils and natural killer cells. The neutrophils will limit the spread of the infection and can inactivate the bacterium replication and inclusion. Dendritic cells will eventually be recruited, where they either cause inflammation or invade the pathogen. Dendritic cells will mature, migrate to the lymph nodes, and invade and phagocytose the pathogen that comes through. They will also activate the T cells, and the adaptive immune system will eventually get involved. The adaptive immune system is a more targeted and specific response, so it takes a little longer to get activated. And eventually the two together, along with the treatment that I'll talk about later, will get rid of the infection completely. So speaking of some treatments, because this is a bacteria, we are able to use antibiotics. For my patient, I disclosed all of the possible options for treatment that we could pursue, and then I decided the best one. The first treatment that is common for a chlamydial infection is to take the antibiotic azithromycin. This is in pill form and is a single dose of 1 gram. In other words, you take the 1 gram and that's it. Unfortunately, recently there has been some studies that there is a resistance from the bacteria. So that one's kind of on the back burner right now. So the one that I decided was best for my patient was an antibiotic known as doxycycline, and it is also a pill form. So doxycycline is prescribed as a 100 milligram tablet that is taken twice a day for 7 days. The patients are advised not to participate in any sexual intercourse at all, oral or vaginally, anally, etc., for at least 7 days after they have been diagnosed and treated. So antibiotics work by blocking the replication of bacteria and killing the active bacteria. More specifically, the chlamydial bacteria needs some specific proteins in order to keep invading the host cells, and doxycycline will not only enter the bacteria cell and infected cell, but it's also block the production of these proteins. So it basically just shuts down the whole process of the bacteria. Unfortunately, not everyone wants to talk about this part of treatment, which is alerting your partners that you had an infection. It is a very embarrassing conversation, but it is a conversation that is absolutely needed, because if not, they will continue to spread the infection and it'll get worse and worse, and numbers will continue to increase. So also, it's been found that a person who has had chlamydia, they're possible to have repeated exposure and repeated root infection, which we don't want. So talking about some preventative measures that we can take, we as an entire population worldwide, treatment and prevention essentially go hand in hand. It is a completely preventative disease if the guidelines are followed. However, if you do get a chlamydial infection, it's okay, we can treat it, but then you have to start implementing the preventative measures that are discussed here. It's a cycle. If you don't do one thing's gonna happen. So let's break that cycle. So one of the easiest ways to prevent the spread of chlamydia is to practice safe sex. Condoms are 98% effective in preventing chlamydia if used properly and every time. That every time part gets people. You can expect to be protected from STIs if you have sex 4 times a week and only use a condom once. It's not exactly how this works. Additionally, a dam can be used, which is essentially a piece of thin plastic or latex. They make dental dams for oral sex. They make dams that can be used in the genital area. It just depends on the type of sexual contact that the people will be involved in. So another thing we can work on is to practice proper sanitation and good hygiene. The easiest one is to follow is the condoms and to rinse off after any sexual contact, oral, anal, vaginal, etc. It really doesn't matter, you should rinse off. Urinating after sex will also allow the body to flush out any bacteria that may have been present and left behind. Everyone knows that trick. Men and women should do this, but more specifically women. So having clean hands before and after intercourse can prevent the infection from spreading. Here is the big thing that will relate to the trachoma of the eye. So having your own clean towel is also important. If there's bacteria from bodily fluids that's found on the towel and you or your partner uses it, the bacteria will enter the body, either through the eye or back through the mucosal membranes. And individuals with chlamydia infections are at a higher risk for HPV infections if the preventative measures are not implemented and followed. Again, this is simply because there's poor hygiene or safe sex isn't being practiced. There's lots of different reasons. So there's another reason we don't want HPV. So a third thing to prevent chlamydia is to educate yourself and others about the risk of sexually transmitted infections. Even if you're not an expert on chlamydia, you can still alert people of the commonality of it and the long-term effects it causes. Parents, please talk to your kids about it when initially talking about the birds and the bees. It might, again, it's an awkward conversation for your child and you, but we really need to start talking about it. Again, getting rid of that stigma. There's nothing wrong with talking about sexually transmitted infections because they happen. If you know someone who's at risk and not practicing safe sex, remind them about ways to prevent infections and, just buy them a box of condoms if you want to. But let's be sure to not use fear to persuade other people. Hopefully you will remember something from this talk and the statistics I'm about to share with you. Even if you don't have to be an expert to talk about chlamydia or any other STI. But if you do want to get the correct numbers, look up statistics. The CDC always has new numbers coming out. The US is one of the highest countries for sexually transmitted diseases, infections, excuse me. So you've learned about my patient. You've learned about her treatment, her diagnosis, and what exactly chlamydia is and how it works. And I'm sure most of you are sitting here thinking, why should I care? It won't happen to me because we all feel that way at some point. So here's the numbers. In 2018, there were approximately 68 million sexually transmitted infections in the United States alone. Yes, you heard that right, 68 million in the United States. This number did include all sexually transmitted infections, not just chlamydia, but that translates to 1 in 5 people in the United States having an STI. And you think it won't happen to you? It's wrong. It's very likely to happen to you if you don't practice safe sex. Chlamydia had a prevalence in the United States in 2018 that was about 2.4 million, which is a lot. However, the estimated incidence of chlamydia reached upwards of 4 million. So let's get one thing cleared up. Prevalence is the estimated number of infections, new or existing at a given time. And incidence is the estimated number of new infections that have been diagnosed or that are undiagnosed. So with that being said, that's approximately 4 million undiagnosed cases of chlamydia. That is a lot. And that's just in one single year of 2018. So with these numbers that I just disclosed, chlamydia was the most notifiable sexually transmitted infection in the United States. The incidence number is so much greater because there are a ton of individuals who are undiagnosed or can't afford to get tested. It's a very real problem that we still see in healthcare. Individuals can't afford healthcare or are uninsured or illegal and don't necessarily have the access they need to get things like this and to get represented in general. So in light of that, my clinic is having a free STI testing next Friday. Anyone is welcome to come in and get tested. However, we are hopefully trying to target the lower income, uninsured, or illegal population, but anyone is welcome. We'll be there until there's no more people there. My staff and I are excited to help people and just see where it goes. So another thing to note is that with this clinic, individuals that don't have insurance can buy an STI kit from home. And from most clinics, they offer them. However, sometimes they're a little expensive. The most common one is from everlywell.com, and it's about $130. I know that sounds expensive, but for someone who doesn't have insurance, it's worth it, and it's much cheaper than going to the physician's office. There are many options for testing and no excuse to not get tested. So if you haven't had your annual STI check, go get it, please, as soon as possible. When I first began my talk, I mentioned that one of the long-term effects of untreated chlamydia can be blindness. And not a ton of people know that. But let's talk about it. So trachoma is the leading cause of blindness worldwide. Typically, trachoma is shared through direct contact with the eyes of an infected person. This can include infected bodily fluids having contact with the eyes, or just any dirty towels or cloths, or even flies that come into contact with the eyes or nose. Trachoma is caused by serotypes A through C. And if untreated, the trachoma will scar the inside of the eyelid and scratch the cornea of the eye. This is what leads to irreversible blindness. It is really unfortunate. It is seen in the top left corner. Not only can it happen to an individual, if a pregnant mother has vaginal chlamydia, this can also be shared with the baby. Blindness is actually, unfortunately, really common for babies that were vaginally delivered because the infection will be on their eyelids as they pass through the canal. So if nothing else, pregnant mothers should get tested for an STI as soon as possible once they're aware, if they're not doing their annual checkup. And based on the faces that I'm seeing right now from all of you, I'm guessing that not many of you are aware of this. If this sticks with you, I'm happy. It reiterates the importance of preventative measures and getting tested. So another long-term effect is known as pelvic inflammatory disease. This disease results from an untreated infection of chlamydia and will most often lead to infertility, ectopic pregnancy, miscarriage, and chronic pelvic pain. My patient was experiencing chronic pelvic pain, so we think that her infection had lasted for a while and she just wasn't sure about it. Unfortunately, chlamydia is really often asymptomatic, and that's why most men and women are unaware. It has been found that up to 2/3 of cases of infertility and 1/3 of ectopic pregnancies were caused by chlamydia trachomatis. Like I mentioned, if a woman is pregnant and has chlamydia, there is a higher risk for preterm labor, rupture of the amniotic sac, low birth weight, fetal death, and postpartum endometriosis in the mother. So it's a big deal. Chlamydia is a serious infection in men and women that can cause many life-threatening factors for the baby and intense pain and infertility in the mother and the man and the father. It has been found that there's a 50 to 75% chance that a baby will have a chlamydial infection, either conjunctivitis, nasopharyngeal infection, or pneumonia, if they are born from a chlamydia positive mother who's unaware of it. Men also have some risk factors and public health implications that are really important to be noted of. So men are at a higher risk for epididymitis, or inflammation of the epididymis and the testes. It has been found that men with an untreated chlamydial infection are also at a higher risk of infertility and other secondary infections. It has been studied that the chlamydial infection will have a dramatic effect on sperm quality, and prolonged infections can have an effect on not only the sperm quality, but also the number of sperm. So, as mentioned in this entire talk, chlamydia is a serious but very treatable and preventable disease. I hope that you all have taken in the things I've shared with you. In today's world, scientists are working on a vaccine that will prevent it without affecting any of the other body tissues and body functions, but it isn't quite ready yet. So until then, I want us to all work together to prevent the spread of chlamydia and decrease the prevalence and incidence of it. Please, I cannot stress this enough, take the time to educate the people that you know about the seriousness of STIs in general. But as seen today, chlamydia is number one. So let's, if nothing else, let's work to fight chlamydia. Be sure to talk to people who don't have proper hygiene practices or don't practice safe sex. To all my pregnant women in here or who are wanting to be pregnant, go get tested. And tell your other pregnant women in Facebook groups to go get tested. It is of utmost importance to get tested. Parents, tell your children. Children, tell your friends if they're at an appropriate age. Let's start the fight against sexually transmitted infections and the long-term effects. Also, I really want to erase the stigma that people with STIs are dirty. Perhaps they didn't know any better than some of you sitting here, and that's okay. So let's work, let's fight it. Thank you so much for listening.